Hello, everyone. It is a pleasure to join you and to give this presentation. The title of my presentation is Exploring Potential Pathways from Adverse Childhood Experiences to Bullying and Victimization, Implications for Clinical Practice and Policy. And to introduce myself, my name is Junsung, and I'm an associate professor at Wayne State University School of Social Work in Detroit, Michigan, USA. So I'm going to start with the background of my research. So I wanted to introduce what adverse childhood experience is. Well, according to the CDC, Center for Disease Control and Prevention, Kaiser ACE study, which conducted the first uh, adverse childhood experiences study from 1992 to 1997, adverse childhood experiences are a major public health concern. And there are various types of adversities, such as household challenges, which might include like parental divorce, parental substance abuse, and parental incarceration. Adversities might also include abuse, such as physical, sexual, or emotional abuse at home, or in school, or in other environment. Also, adverse childhood experiences are experienced by 2/3 of individuals in the US from 2011 to 2020, according to CDC. And adverse childhood experiences are associated with various negative outcomes, such as poor school performances, psychological problems such as traumatic stress, and delinquent behaviors, including substance use. Given that this study focuses on how adverse childhood experiences are related to children's bullying and victimization experiences, I wanted to give an overview of what bullying victimizations are. Bullying is defined as causing harm, being repeated, and it's characterized by power imbalance. Bullying affects approximately 20% of US school-age students, but the prevalence rate of bullying varies by studies. Nevertheless, bullying has been found to be associated with poor school performances, psychological distress, including trauma, risk behaviors such as substance use. Research has also focused on relational factors that directly impact the child, such as maladaptive parenting and parental abuse, and how they may be related to bullying and victimization. Also, research over the years have explored contextual variables that indirectly are associated with children's bullying, perpetration, and victimization. For example, exposure to domestic violence, which is one of many types of adverse childhood experiences. However, it is likely that children who are victims or perpetrators of bullying have experienced more than one adverse event, which could increase bullying and victimization risk. Adverse childhood experiences involving primary caregivers include domestic violence, divorce, incarceration, mental illness, drug problems, and death, which are potential risk factors for bullying and victimizations, as studies have found. Also, adverse childhood experiences involving caregivers are likely to disrupt parents' emotional availability and impact children's relations with others. To put that simply, parents who experience adverse childhood experiences are likely to have problems in parental relationships with their children or parenting, which can negatively impact their children's relations with others outside the home. Literature suggests a strong connection between adverse childhood experiences and bullying. However, individuals who experience adverse childhood experiences are likely to go through various behavioral and psychosocial problems before experiencing bullying or victimization or both. Individuals with adverse childhood experiences experience psychological distress, especially depressive symptoms, which can lead to social difficulties. So based on what's available in the literature, we came up with the following study. First, we proposed and tested pathways from adverse childhood experiences to bullying perpetration and victimization, and more specifically, whether the pathways might differ by sex. Adverse childhood experiences would be associated with bullying perpetration and victimization through the mediating roles of depressive symptoms and difficulty making friends. Also, depressive symptoms will be positively associated with difficulty making friends. Depressive symptoms and difficulty making friends will be associated with bullying, both perpetration and victimization. So for this study, we used the 2023 National Survey of Children's Health, which is NSCH. So 2023 is the most recent data set. And the sample consisted of 122,000 randomly selected households who completed the screening. About 88% completed web survey and 12% completed paper survey. For the current study, we focused on caregivers of youth ages 12 to 17. And the final sample was 16,170 caregivers of youth ages 12 to 17. So that was the final sample for our study. The measures for our study consisted of the following variables, including adverse childhood experiences, which consisted of 7 items, bullying victimization and bullying perpetration, which consisted of 1 item for each, youth depression, which consisted of 1 item, difficulty making friends, which also consisted of 1 item, and covariates, which included child sex, age, and race ethnicity, as well as caregivers' age, sex, educational level, number of children, and family income. The analytic methods included descriptive statistics, t-tests, confirmatory factor analyses, and structural equation modeling. But in the interest of time, we will only present on the descriptive statistics and the structural equation modeling. If you have any requests, or if you want to see the study and how the analyses were conducted, please feel to contact me. So here are our results. As I mentioned, I will only present on the descriptive statistics or sample characteristics and the structural equation modeling results. So first is the descriptive statistics. So as you can see, the sample characteristics are divided into total, female, and male, since we're looking at sex differences as well. So I'll give you a minute to look at our descriptive results. And here are the results of the structural equation modeling of bullying victimization. As you can see, the pathways were almost all significant for both males and females, with the exception of the pathways from adverse childhood experiences to difficulty making friends for males. And here are the results of the structural equation modeling for bullying perpetration. So similar to bullying victimization, the pathways are almost all significant, but when we look at gender differences, the pathways from adverse childhood experiences to difficulty making friends was not significant for males, and also the pathways from adverse childhood experiences to bullying perpetration were not significant for males. To summarize our results, we found that adverse childhood experiences were associated with bullying victimization for both males and females. A possible explanation is that males and females become increasingly vulnerable when they experience adversities. so it doesn't matter what your sex is. And due to vulnerability, they become easy targets of bullying. We also found that adverse childhood experiences were associated with bullying perpetration for females only. Although this finding was a bit surprising, it might be that males may be less affected by adverse childhood experiences, especially at home. Well, according to gender socialization theory, males tend to engage in independent explorations, where females have been encouraged to cultivate feminine roles such as nurturance and attachment, which might explain why females who experience adverse childhood experiences may be prone to bullying perpetration. We also found that adverse childhood experiences were associated with depression for both genders and difficulty making friends for females. Well, one possible explanation is that exposure to adversities could increase the risk of depressive symptoms. Also, adverse childhood experiences could negatively impact adolescents, socialization, and peer relationships, especially for females. We further found that depression was associated with difficulty making friends for males and females. The depression is negatively related to social skills, as many studies have found. And youth with depression may alienate others and have fewer opportunities to form friendships, which could be a possible explanation. Further, we found that depression was found to be associated with bullying victimization and perpetration for both males and females. Well, one possible explanation is that youth with depression tend to be in a vulnerable state, which can increase their odds of victimization. Moreover, depressed youth may also engage in misbehaviors such as bullying, because depression can steer youth towards non-conventional peers who might engage in similar misbehavior. The study also found that difficulty making friends was associated with bullying victimization and perpetration, as difficulty making friends can make youth be perceived as social outcasts, which can increase the risk of bullying victimization. And as previously mentioned, youth who have difficulty making friends may turn to non-conventional peers who engage in misbehaviors, including bullying, which can influence them to engage in similar behavior. Well, like with any other studies, this study has several limitations that need to be acknowledged, which might have implications for future research. One limitation is cross-sectional research design, which can limit causal inferences. And it's important for future research to consider longitudinal research design. Another limitation is using measures based on parent reports, which is likely to have introduced biases due to underreporting or inaccurate recall. So it's really important for future research to consider measures from multiple sources, not just from parents, but also from youth themselves, as well as teachers or peers if relevant, which can increase the validity of the findings. Another limitation is that the adverse childhood experiences were measured with 7 binary items, which may not capture the complexities of adverse childhood experiences. And finally, adolescents who are not in school were excluded from the study, which is likely to have biased the results towards less vulnerable population. Well, these limitations aside, this study has major implications for practice. First is a need for systematic screening and early intervention. For practitioners such as psychologists, counselors, and social workers, they might consider certain programs that have shown a lot of promise in addressing either adverse childhood experiences or bullying or both. One such program that's found to be very promising is trauma-informed practices within school. Trauma-focused cognitive behavioral therapy, for example, has been shown to be very promising for youth who are affected by both adverse childhood experiences and bullying. Another approach might be social emotional learning, which is beneficial for students experiencing trauma due to adverse childhood experiences. And peer mentoring program could be another program that practitioners might consider, which has been shown to reduce bullying through promotion of friendship, belonging, and safety. Pre-service teacher training in trauma-informed practice is very, very beneficial, as it has been found to be very beneficial for bullying. Interestingly, very few schools have pre-service teacher training in trauma-informed practices. And finally, restorative justice can inhibit misbehaviors and facilitate self-regulation and self-determination. So restorative justice is another promising program that has been found to work well with bullying. And it could work well with children or adolescents or adults who are affected or were affected by adverse childhood experiences. Findings of the study also has implications for policy, especially concerning bullying. Anti-bullying laws and policies definitely matter for bullying. In fact, states saw 24% drop in bullying when they complied with the guidelines by the Department of Education and had a systematic anti-bullying laws and policies. Anti-bullying laws also reduce depression, trauma, and suicidal behaviors. However, the current anti-bullying approach relies on an investigation and punitive model, where such approaches may seem like the solution, but they've been found to be not only ineffective, but also possibly detrimental to children and adolescents. Anti-bullying laws and policies also need to consider mandating screening for adverse childhood experiences experienced by students. This could be more effective for the students who are affected, such as bullies and victims, as well as their families who are experiencing adverse childhood experiences and associated mental health problems, including trauma. In conclusion, it's important to acknowledge that adverse childhood experiences are public health concerns, as are bullying. And adverse childhood experiences affect 2/3 of US children. And as I mentioned earlier, bullying affects about 20% or 1/5 of US children. Practitioners working with students involved in bullying need to also thoroughly assess for adverse childhood experiences. It's also important for practitioners to develop and implement trauma-informed interventions that address adverse childhood experiences and associated outcomes such as bullying. So that concludes my presentation. Thank you very much for your interest. If you have any questions or if you want more information about this study, please feel free to reach out to me. I can be contacted by email at fl4684@wayne.edu. Thank you.